And epidemiologist Dr. Avery Hinds admits it's difficult to say how many people would have been infected by COVID-19 despite being fully vaccinated. Health officials have previously noted that a fully vaccinated person can still be infected with the virus, but the vaccine reduces the likelihood of hospitalization or death. Dr. Hinds says at this point in time, it's not as easy to say how many of those cases are locally.
Because not everyone who has a COVID-19 positive test captured also has their vaccination status captured. So sometimes it's not captured either way, so you're not sure if it's a no, not vaccinated, or we don't know. And therefore, it's difficult to say with any certainty how many people have been fully vaccinated and yet still acquired the COVID-19 infection.
He reminds that getting inoculated also reduces the risk of both becoming infected and transmitting the virus to others.
The COVID-19 vaccinations that we have reduce the risk of transmission, not all the way to zero, but significantly. And therefore, the more people that we have fully vaccinated, the greater the overall population effect will be in reducing both infections in individuals and transmission onwards.
Over the weekend, health officials in Barbados indicated that there were 10 cases of fully vaccinated people testing positive for the virus. 4 deaths and 109 new COVID-19 cases, the latest figures from the Ministry of Health. Monday's clinical update says of the 4 new deaths, 3 were men and 1 was a woman. All had comorbidities. These 4 deaths bring the COVID-19 death toll to 1,043. Meanwhile, there have been 106 recovered community cases and 18 persons discharged from public health facilities. With the new cases reported from samples taken during July 22 to 25, there are now 5,894 active cases of COVID-19. The numbers of fully vaccinated persons continue to climb. The ministry says 182,400 people have received both doses of a vaccine, while 349,225 have received a first dose.